Hi, Dr. Brotsky here. Welcome to week 17 of your pregnancy. So right now your baby is about 5 inches long. So that's really exciting. Baby's getting bigger and bigger. What to expect right now is possibly some of that round ligament pain that I mentioned before, the sharp pain in your groins when you get out of a chair too fast or when you walk around a lot. So this is very common, very expected, but can take you by surprise. So call your doctor if that does happen. The other thing that we see commonly is back pain and also leg cramps at night. Patients complain of this very, very often around this time. So keep your eyes out for that, but hopefully you won't have either of those things. And urinary frequency, as I mentioned in a previous video. But always leave a urine sample at your doctor's office so they can double check for infection. Your doctor may talk to you about scheduling an anatomy ultrasound around this time. So this is an ultrasound that is routinely done in pregnancy, anywhere between 18 and 22 weeks, so they're going to start scheduling this for you. There's either a level 1 or a level 2 anatomy ultrasound. Level 1s are done for low-risk patients which have no additional concerns for any abnormalities. Level 2 ultrasounds are more detailed. They're usually done at a perinatologist or a high-risk doctor's office. And they're usually just for patients that may have other things going on in the pregnancy, and we want to really double check that everything's fine. Either way, they're going to look closely at the baby's heart, at the brain structures, at the abdominal structures, and measure everything as well. So that's an exciting time to get lots of pictures, and that can definitely be the time when you find out your baby's gender for sure, if you definitely want to know. The other thing to think about right now, make sure you're drinking plenty of water. I commonly get questions about travel and pregnancy around this time as well. And the recommendations generally are that if you have a low-risk pregnancy, you can travel internationally even up to about 35 weeks and domestically until 36 weeks. That's pushing it a little bit, obviously, if you're having contractions or problems when those times come. Regardless, you are more prone to forming blood clots in your legs and things of that nature when you're pregnant. So just make sure that if you do travel, whether it's a long car ride or you're in a plane somewhere, you want to make sure that you don't sit for longer than 2 hours at a time. Get up, stretch your feet, walk for 10 minutes if 2 hours has passed without doing that. Things that you can look out for around this time period are feeling more fetal movement. Watch out for any bleeding, any severe cramping, and make sure you call your doctor right away. If you start to notice that your feet get tired or achy, make sure you rest when you need to, drink plenty of water, and elevate your feet. So that's it for week 17. Thank you so much for tuning into this video. Watch my other ones on the same channel, and you can always find me on drbrotsky.com.